Okay, can you all see my screen? If you can, let me know. Put one in the comments if you can. If you can see that, let me know if you can. Wonderful stuff. Okay. So today we're talking about the management of quality in health and social care. Now, okay, don't want to start. Okay, perfect stuff. Should I carry on? I don't know where they gone, but should I carry on? I don't know, but should I carry on? Okay, well, I think, yeah, so sorry about that, guys. So yeah, today we're talking about the management of quality in health and social care. So I'm going to move on to the first screen and then we will start talking about it. So management of health and quality in health and social care. What is it all about? So within our industry, you know, we are bound, it's fair to say we are bound by different laws, legislations, regulations, and we are also bound by specific guidance within the health and social care industry today. And one of those, you know, an area that we are governed by is the need to have a high level of, quality in our industry today. And as you know, management and people in quality assurance, our role is to provide that actual quality itself. And so as part of our role, quality assurance it's something that we must adhere to. And it is also, and we must be able to make it seem that our practice has a huge important role in the way we do stuff and in the way we do, go about on a day-to-day basis. Good evening to yourself, Alaba. Good evening to yourself. So yeah, and then the other thing about the management of quality within health and social care is that there is also the factor of making quality improvements. So we must be also finding out how we can ensure that our quality is being improved, and also our practice is of quality as well. So from a management level, quality assurance is all about, maintaining that our quality of work is to a high standard. It's showing like the government, it's showing the top people within the health and social care in this industry that we are assuring them that our work is of a quality basis. And when it comes to now improvements, it's also there for us to be able to say that we are taking the right steps to improve our quality in the work that we do today. So I just want to quickly read you a quote that I had been looking at today, and I think it's you know, I think it's very key. So if you think of, you know, quality assurance, so Google would have a definition of it, and Google says that quality assurance is any systematic process of determining whether a product or a service meets specified requirements. So within the health and social care industry, how you could apply that is the processes you've got, the strategies you have, the different types of departments you've got. Are they meeting the required needs? And if so, in what criteria do they meet that specific need? And you know, pretty much, you know, like we said before, the role of quality assurance is, you know, ensuring that the products and services meet the established standards set by the management itself or the company in that particular aspect. And so there's 5 different components of quality insurance. So at a health and social care level, you know, it's all about the products. So the products that you use on a day-to-day basis. So like, you know, your the medication, the medication, everything else like that as well. And then it's also like the manufacturing part of it as well. Is that all up to board? Is that all up to speed? And then it's also about, you know, just that particular thing of releasing the medication into the public. Is it ready for release? Is it fit for release too? So, yeah, I want to now move forward to, let me move forward to the next part. Okay, cool. So, is that the one? Yeah. So, but just quickly, you know, there are 3 other pillars of quality. Those pillars are integrity, honesty, and courtesy. So honesty, of course, if you're honest about what is happening within your business, you are more likely to make, you know, you're more likely to take improvements to improve the quality of your business. The other part is integrity. So you would do, if you said you're going to improve the quality of your business, what you are doing is you are actually giving your word that this is what you are going to do. And courtesy is pretty much that it's the right thing to do. It's the right action to take. So quality improvement, let's talk about that a little bit. When it comes to business, when it comes to looking at our business as a whole, what type of models of quality improvement are there? So there's various models of quality improvement which can help us improve what we have inside our business. So the first one is the SMART model. Now, the SMART model is somewhat used in the coaching aspect. However, when it comes to improving quality, and you are more likely going to set goals or set targets for your business. So let's just go through each one. So the first one is that was supposed to say specific. So quality improvement, what specifically are you trying to, are you wanting to improve on? What part of the business are you looking to improve on, or do you want to improve the quality on? So is it customer service? Is it the products? Is it the business as a whole? What type of area in your business are you looking to improve on? The measurable part of it now is how are you going to measure the quality? How are you going to measure whether the quality has been improved or not? And then when you look at achievable now, you're going to look at it from the aspect of is it achievable? Is it achievable for me? Is what I've stated achievable? Can I actually do it? And then the next one, realistic now, is that thing of what realistically can I do to improve the quality in my business? So when you're looking at realistic, you might be looking at your funds, you might be looking at the people who you've got in the workplace, you might be looking at the stakeholders within your business, you might be looking at the resources you have as well. And one thing that I would say is that it's very important, because you don't want to be setting high goals and you can't achieve it. And now the next thing is time orientated. So within your business, when you are setting goals and you're setting targets to improve the quality within your business, you need to know whether it is those goals, in what time frame are you looking to do it in? In what time frame are you looking to improve the quality within your business? So that really is one of the models that you can use of quality improvement. The next one now is something called PDSA. So the PDSA cycle, it stands for plan, study, do, and act. Now, when I was looking at that in preparation for today's session, I looked at it and I instantly linked it to quality improvement. So let's talk about each one quickly. So the first one is plan. So a bit like the SMART model now, this is a bit different. You're gonna have a plan. So you may get together with people in the team, or if you have a quality assurance team already, you may want to be saying things like, so what's the plan? Now we've got the results from the quality assurance test. What's the plan for improving quality within the business? How will I be able to put specific things in place so the quality can be improved? The next thing is around study. So they're going to be studying certain aspects of quality and your business, so you can really see what you need to do to, you can really look at what you need to do in order to take action. The next thing is do. So just do it. Do it. Do what you have said and say what you have done. So that's when your integrity comes into play. So, if you've committed to a stakeholder about these particular areas and you're going to make changes in these areas of your business, then that is the thing that you should be doing, right? And then the thing is act. So that's the next level up from doing. So you're acting upon whatever you have said, whatever you have planned out, and whatever you have studied as well. So these are just two specific models that you can use when you are looking to do quality improvement. Okay, cool. So we now want to look at another aspect of quality improvement itself. And I'm just going to take a minute to, quality, quality improvement. Quality improvement is all about, it's all about giving like the people closest to us, or the people closest to, the people closest to issues affecting the care quality, the care and quality, the time, permission, skills, and resources they need to solve those particular problems. So, if you've got a team of doctors, a team of nurses, a team of orthodontists, dental people, or anybody in the healthcare industry itself, what you want to be, what you want to be doing is like, getting their opinion on it. Now, the NHS is a great standard for us to follow in terms of quality improvement. And they already have a framework in place of quality improvement. So what NHS have said, quality improvement is the continual actions to improve outcomes for service users and to develop the workforce that supports them using systematic methods. So it's what we talked about before, right? And, these two continual elements are continual and a systematic approach. So if you think of it, continual methods are the things you do on a daily basis. So if you look at it as, you've got a team of carers, you've got a care team, and you've got a multidisciplinary team. Now, the quality of care is not up to standard. So for you to do that, you may want to provide training, or you might want to up-level your skills, or you might want to bring in resources that will help the staff to solve that actual problem. And so, like we say here, it involves a systematic and coordinated approach to solving a problem, using specific methods and tools with the aim of bringing about a measurable improvement. All successful quality improvement programs will include the following four components: the problem, goal, aim, and measures. Now, why one of the reasons why that is important is, one of the reasons why that is important is that for you to, make anything right, you need to know what the problem is first. You need to know what the problem the company is facing. You need to know what the problem the service users are having within the business. And then you want to come together and you want to look at the goals. So what's the goal? What's the achievement? What do we aim to do? And then after that, you will look at the measures you're going to put in place. What realistically can you put in place to, to improve the quality within the actual business itself? So let's carry on quickly. But I just want to read to you a bit of something that the NHS said themselves in a document they put out a couple of weeks ago. So the NHS, they brought out a framework, quality improvement framework. And one of the things they said is that there's no single best approach to quality framework. However, there are specific attributes. There are specific ideas and skills that, that are closely linked to things like leadership and giving direction, engagement of service teams. So the service teams like your ambulances, your the ambulances, the porters, etc., participation of the service users. So how do the service users view the business? How do they view the carers? How do they view the nurses? How do they view their care? And then, it's all about quality improvement, skills development. So are your staff needing to develop their skills? If they are, how are they going to develop it themselves? And then you've also got to look at the continual efforts to improve. So every day is a learning game. Every day is a learning process. So when you have a meeting with your boss after work, that forms part of quality improvement, because you are improving the quality of your work, aren't you? And so really it comes down to, for you to frame quality improvement, like we said, you need to bring in the people who are closest to it. So like the patients, service users, carers, the public, when they get involved in quality improvement, it encompasses everyone. And when you talk about service users, it brings them all under one umbrella. So let's move to the next bit quickly. So let's look at the different strategies in which let's look at the different strategies in which we can use to improve the quality inside health and social care. So there are different strategies that we can use to help us achieve particular quality within the health and social care in the industry. And one of those ways is via the CQC, the Care Quality Commission. Now, the Care Quality Commission, like the main role of their job is to help to achieve quality, and how we can look at ways that we need to improve that particular quality itself. So if you think of the CQC now, they'll be going out to different care homes, hospitals, hospices, respite day centers, all of those particular places where they give out care and services and support. And they'll be really assessing things from a management perspective up here, a departmental service, and underneath it will be giving you the views from the service users themselves. So the public, the carers, everybody who's like using that particular service in it. And so with that, what the CQC do, they will then decide what needs to be happening and what is going on, to be fair. And so apart from the CQC, there is also something known as benchmarks. So the benchmarks, like, they are standards that we need to meet in the industry, or things that we work towards. So we have to find out what those benchmarks are and how best we can meet them whilst maintaining a high level of quality. Now, the CQC are a great company because they regularly set out industry standards or industry benchmarks. Or if you're looking at the NHS now, the NHS will, the NHS will set out a standard that all homes and services in the healthcare industry need to adhere by. And that's one of the reasons why in every company you get quality assurance teams. So these people are just focused on assessing quality within the business. These people are concerned with how the company is performing on a day-to-day basis and whether the participation is of a quality level. So, okay. So for us to, somewhat improve quality, we then need to get information from various sources about how we provide care. We need to get our sources so we can then begin to see the care and how we can improve our care. So one of the things we can do is we can get feedback. So if you look at the purpose of feedback, so the purpose of feedback is it's three different aspects. So the first aspect is saying to the managers and so forth that, listen, you're doing a very good job. You're doing a really, really good job. And, this is what I think you are doing well. Then the other part is, I don't think you're not technically meeting the standards. This is a way in which you can improve the quality inside your business. So then they're not saying it's bad. They're just saying that you could do a bit better, I guess. Now, one of the ways in which you can get feedback is you can get feedback from various sources. So if you think of it in an organization, let's say you will have a team of staff. You will have a team of you'll have service users. You will get family members. You'll have colleagues as well. And then you will have like fellow partners that you will be working in conjunction with. And so the reason why you need to get your feedback from fellow partners is that, it's so that you can see what the partners think you are doing best. And the NHS, they've got it down to a T. So they say that, they believe it's important for patients' views and services that they have received to be heard in a particular manner. So, so pretty much like, if you say what you want to say about the business or the service you've received, or you want to tell people that you've had a good service or you haven't had a good service, you can do that via feedback. Now that feedback can come in so many ways, so many different ways. So it can be a one-to-one conversation. It could be in a group session. It could be over Zoom. It could be via paperwork. It could be via an appointment at the GP. Anything you can think of that you can create feedback with is what the companies will take and use to then begin to see how they can shape the aspect of quality improvement itself. Now, why is it important for service users to give feedback? Reason being is that service users in the UK and abroad, I would imagine as well, they form an important part of the service industry itself. So it's fair to say that, you know, service users in the industry today, because they use the service every day of the week, 365 days a year, they have some important input because they're able to help the company look at how they can, how they can, you know, how they can mold the business to meet the needs of the service user. Colleagues, they have a great input because they're able to, you know, share what is going well and what isn't going well. And that will be very helpful for when they have training or they have, courses to go on, or they're working with new people as well. What the colleagues say is good for the people at the top to understand as well. The next thing about that is, you know, families. Why are families so important in that particular aspect? Families are important because, number one, their loved ones might be in a place where they don't have control over. Their family members might be in a care home, in a hospice. And to that length, you know, the family don't look after the person anymore. That part of the care has been handed over to the different professionals as part of the service users' recovery, let's say. So the family need to be very safe that, yeah, it's going to work out, innit? Now, the public, why should the public be involved? What would the public have to do with quality insurance? Now, the public have a very big role too, because the public, they can, you know, they'll be able to tell the people within a company that, you know what, I think this should change, or this should be changed, or that should be changed, or no, they shouldn't be doing that. One of the reasons why is that the public use this service too. They might not be a service user yet, but they come in contact with the company on a number of occasions. And, you know, it's getting in touch with that company itself. You can then be beginning to, you know, look at everything as a whole. So from a public point of view, from a public standpoint, how does our business look? What does it look like? What do people think about our business? Now, another thing I want to mention about the public itself now is that the public, they form a very strong voice. However, some parts of the public may not have a voice because they may be in certain categories or certain stereotypical categories that not many people listen to. And for some people, it feels like they might get left out. So for them to actually be included in the business, they need to be listened to as well, right? Now, fellow partners and those who you work in partnership with. So fellow partners, that could be, you know, anybody within the company. So it could be psychologists, it could be physios, it could be dietitians, nutritionists, surgeons, pretty much anything you can think of, to be fair. And the fellow partners, they will probably have 9 times out of 10 the best view of quality improvement and how a company should manage that particular quality aspect. Now, even within that as well, the people who you work in partnership with, they will also be looking at ways in which you can work together and also be sharing what is good for you and what isn't good for you as well. And you also can share what is working well in your company and also see if you can adapt that in your own company too. So as part of that particular feedback that we just talked about, there are certain methods that influence how we can gather feedback. So our remit is to find out what model can help us to gather feedback. So like I said, guys, that particular feedback, it can come through people, it can come through paperwork, it can come through on the site assessments, it can come through, surveys, it can come through webinars, it can come through customer satisfaction forms, it can come from any way, shape or form. But the purpose of this particular feedback is so that we can then begin to look at like how we can best improve our practice, and also we can provide quality in that particular context. And another way in which you could provide feedback is you can provide feedback by making a complaint or making a comment. Now, most people may not see complaint as a feedback. They may not see it that way, but feedback is everything that they're giving back to you. So you take that on board and you look at everything they've said, and you can then begin to put it together, piece together the feedback, piece together your own risk assessments and see what you can do moving forward. Another way in which you can get feedback on your services is to allow people to write comments on certain websites. So if you've got a website and people are on there, they can leave comments. Yeah, they can leave comments. They can leave comments on the work that they have received. Or another way is you can also put together like a customer steering group. So a customer steering group is basically a group where you have service users. It's made up of multidisciplinary actually. So you have service users, professionals like psychologists, doctors, dietitians, all of those people in it, and people who do local care. So like your district nurse, your podiatrist, your dentist, etc., etc. They'll all come together and they'll hear people out as well. They will hear people out and they will hear what these people have to say for themselves as well. And so depending on the feedback you get, you can then begin to pull together what you need to do to improve the quality in your business. Now, it's only once we get that particular feedback, you can then begin to look at how best you can improve the practice and also how best you can improve the quality within the business as well. So now we're going to look at another stage of quality and how we can manage quality within health and social care. But like, if you have any questions, put it in the chat box. If you get anything to contribute, put it in the chat box as well. Okay. So let's now talk about the people we work with, the people that are involved in our everyday working life. In our line of work, we will come across several sectors of people that may have an interest in how we do work or how we work with others. Now, it's fair to say, it is very fair to say that as part of our business or our job, if you involve stakeholders in your business, it is fair to say that stakeholder engagement will improve the company's decision-making, the decision-making process. Or if you involve stakeholders in your business, it is fair to say that, you know, the international standard for providing guidance on quality and social responsibility, it defines a stakeholder as an individual or a group that has an interest in any decision or activity of an organization. So if we look at that on a bigger scale, you got to look at how you would identify these particular stakeholders. So, you know, like we said there, these people are called stakeholders, and these stakeholders are different types of people who will, in some way, shape, or form, help us to improve the quality of our practice. And they themselves will have a role in helping us to improve on how we deliver care too. So it says here we need to identify who the stakeholders are and what part they play in helping us to improve. So let's look at the different types of stakeholders and what types. So stakeholders, there's two different types. So you've got primary stakeholders and you've got secondary stakeholders. So primary stakeholders, like these are people who are directly affected either positively or negatively by an organization's actions. So if we look at that pretty quickly, if you look at let's say the hospital for an example, or let's say, you know, look at the NHS, and the NHS have said in a recent document that they have to cut down the number of GPs. Now, in a somewhat weird context, you may not think that would affect many people. However, it does, because GPs are like the hub of the community in a way. So before people go to a hospital or they go to a specialist, they'll always go to their GP first. So the GP is like the go-to person in it. However, if they were to cut the GPs down in half, it has a direct impact on people in the community today. It has a direct impact. And that will then cause a negative chain of reaction, because if people can't speak to their GP, they're going to ring up NHS 111 999. They're going to walk up to the hospital, and their condition may not be that serious. But because they can't speak to their GP, it's peak, isn't it? It's peak. It's, you know, it is very, you know, it's very negative. If you were to then look at, let's look at hospitals, for example, in it. Now, upcoming, NHS have said most of their nurses are going on strike. So, because those nurses are going on strike now, it's almost a thing of, are we able to carry out, you know, are we able to carry out these appointments? Are we able to meet the needs of the people that are coming in to have a chat with us on a day-to-day basis? Another way you might want to look at it is that, you know, during lockdown all over the world, access to, dare I say it, hospitals was quite limited. access to GPs was limited as well. Access to healthcare was limited as well. Now, you can just imagine the impact it will have on elderly people, people who have a disability, people who have an illness, people who can't go out and leave their house and stuff like that as well. Because they felt cut off from society, let's say, there was a real struggle in a way to keep them included with society as well. So part of this quality improvement and quality management we're talking about today is the fact that they had to come up with a way of including these people in society so they didn't feel left out. They had to come up with a solution so these people didn't feel like they were being left out and their voice wasn't heard. So that's why they brought out things like Zoom chats and group Zooms and bringing appointments online and, you know, talking to people over the phone. So that way people felt like they wasn't alone. And then you had the whole, you know, they were giving out food to families that couldn't leave the house, etc., with it. And that was another way of really helping individuals move past that particular barrier of accessing certain types of information and healthcare. So secondary stakeholders are, let's say, people who are indirectly affected by an organization's actions. So if we think of that, so you might say that, you know, say if you think of it, establishments like, you know, the government, other places, you know, employment places and stuff like that as well. They're not technically indirectly affected, but they're still a stakeholder. So when it comes to health and social care, so things like production centers, production areas and all of that good stuff in it, they're not basically affected, but, you know, they're not directly affected, but if you make a decision in your business, so for example, say if the NHS said that they were cutting down the number of appointments, now that can have an effect on nurses, and then maybe indirectly it'll affect universities or agencies because they supply staff to the NHS. Maybe it might not be a big deal, but it could be a big deal moving forward. And so when we now look at, you know, when we look at the stakeholders, now, we have to manage, when you're looking at stakeholder management, you have to really think about how you can get them involved in the project and get them involved in the quality improvement, part. Now, if for any successful project, a stakeholder buy-in is very, very essential. It's very key because, you know, one of the causes of, you know, project failure. So let's take, for example, COVID. COVID. And the government said they were rolling out COVID vaccines, right? 9 times out of 10, they would need to get the stakeholders involved. So the doctors, the nurses, what do you call it? The nurses, the doctors, etc., you know, it's there, isn't it? They all need to be involved. to make sure that it is done efficiently and done to plan and down to a T. So when you look at it, it's you know, when you're looking at why a project fails, it's because that sometimes we don't follow and we don't focus on the stakeholders who have the greatest influence over the implementation and sustainability of that actual project itself. So if you are, you know, it's fair to say if you are to, you know, if you are to have effective management, then you need three things. Those three things are identification, communication, risk planning, and active collaboration as well. So if you are to begin to manage stakeholders, let's say, first of all, you need to identify the individuals and groups the project affects. So down at the bottom, we see that, you know, various stakeholders that could be involved within quality improvement and in health and social care. Some of these stakeholders include owners, investors, communities, employees, government agencies, and, you know, these people are just some of the stakeholders that will be part of your business, let's say. Now, when we look at these particular stakeholders now, we need to do a more comprehensive deep dive into these stakeholders, and also to, like, you know, to really evaluate the individuals who are the stakeholders and like what part they play in it as well. So we then also need to look at their influence and the extent to which they might be affected. So let's look at employees. Employees will definitely be affected, right? They will definitely be affected in some way, shape, or form in it. Now, because of this reason, you know, sorry guys, 1 second. So yeah, because of this reason, employees will definitely be affected. Why? Because they work for the business, they work for the company as well, and everything there, it's like it affects them as people. Communities. Now it's fair to say that there are several communities within a community. So in a community, you'll have a community of learning disability people. You'll have a community of people who have autism. You'll have a community of individuals who are physically disabled. You may then have, what do you call it? You may then have a group of people who need advocacy or have advocates within the industry itself. So when you're looking at the stakeholders, you really need to understand the problems and the issues and what they could be facing. Now, so when you are now looking to provide, when you're looking to provide management and quality assurance, you then need to have communication with these types of people, and you need to really identify the needs for each of these groups. So let's say, for example, the stakeholders who have the most input, the ones who could be impacted the most, they will probably have the most say and the most input because their livelihoods will be at stake, right? Another thing as well is that the people on the project, or the improvement of quality in this sense, they would need to create buy-in, they need to create consensus by using targeted communication. So you can think of that like, you know, group meetings. You could almost think of that as getting feedback, information, etc., etc. Now, the next thing about that as well is if you are to, you know, have communication, let's say, with these particular types of people, you really need to be diverse with your communication and who you target as well. Because like we said, there's communities within the community, right? The employees, the investors, the owners, the government agencies, all of them, whether they're primary stakeholders or secondary stakeholders as well, you know, it's this particular type of people that you really need to get on board. Why? Because the government agencies are the people who set budgets. The employees are the people who work with, like, you work in your business. They are on the front line. They do most of the work. You know, the government as well, they're the ones who set the legislations, the policies, the regulations, all of that good stuff there. And then investors and owners. So investors, if someone's going to invest money into your business or into your project, of course you'll need to know like how best you can get them involved, to get the investors involved and to get investments into your business. And now investors should be primary stakeholders, right? Because they could be directly affected. If you cut off half of your business, let's say, then, you know, investors, you know, they might lose money, or they might, you know, they might lose money in it. And then the owners of the business, they'll probably lose money as well, because they own their business, right, don't they? So that pretty much rounds up our discussion for today. So if we go back on what we talked about, so at the beginning we talked about quality assurance and its role within health and social care. We then talked about the two different models that you can use within quality improvement and quality assurance. We then talked about the Care Quality Commission, and you know, also like the different benchmarks that you can use to improve the quality of the business. We then also looked at the different methods of feedback that you can use, and like why feedback is so powerful for companies, businesses, and organizations. And then we looked at who could be providing feedback, who should provide feedback, and you know, in what way you can get feedback and how you can use that feedback as well in order to improve the quality within your business. And the very last thing that we looked at, well, we took an in-depth look at stakeholders and, you know, who the stakeholders are, what their involvement might be, where were they placed, are they primary stakeholders, are they secondary stakeholders too? And like we also looked at like who might be involved in quality improvement as well. So I just want to go back quickly on something I touched on in feedback here. So within feedback, if you look at it, feedback is basically you're getting the chance to shape your business. Feedback is crucial. Good feedback, negative feedback, it's all part of the game. And it is so crucial, because if you're going to improve your business and you're going to improve the quality of your business as well, it's you know, it's really like, it's really on point, and that you know, we get feedback, because the people you get feedback from will give you a first-hand overview of your business and why your business might be failing or why it's doing well, and what you can do to really improve your business. So with that being said, guys, that pretty much brings us to a close. I'm going to stop sharing